Well, thanks so much for that really kind introduction. It's really a pleasure to be back here, and hopefully I can share with you some of the work that we've been doing and that others have been doing. I think really to improve our communities. Before I get started, I just wanted to just say a few things just to sort of set the stage. Although Dr. Gentile and Norm Anderson, I think, really did a great job in sort of leading up to my remarks today. I think it's probably obvious to all of you that air quality really matters for health. I wanted to give you just some sense of where it ranks. So even though you saw Phil Johnson presented some information showing that we've made dramatic improvements in air quality across the country, and that's in general. There's still some work to be done, but really air quality is much, much better today than it was 20, 30, 40 years ago. But it still is one of our major risk factors for death. So as part of sort of a large analysis looking at 80 different risk factors for death, so everything from behavioral, dietary factors, for example. Air pollution is the 10th leading risk factor for death in the US today. It causes around 90,000 deaths every year. Just to put that in perspective, so smoking is about 400,000 deaths per year, high blood pressure about the same, alcohol and drug abuse 150,000 deaths per year. Air pollution is not far behind. That's sort of the sobering news. The good news, and you've heard this mentioned already today, but I really want to stress it, is that, so why is air pollution so important in terms of health? It's because everybody is affected. We can't run, we can't hide from the air pollution. We do all have to breathe. The good side of that is that when we make an improvement in air quality, everybody benefits without actually doing anything. So that's very different than thinking about a new medication, thinking about the intensive interventions that you have to do with many other sort of diseases that are related to individual factors, to behavioral factors, let's say to dietary risks, for example. If we clean up the air without doing anything, we all benefit. And that's really an important theme. The sort of implication of that is that things that we do to improve air quality just from a health perspective, forget about the fact that, morally we should do this, but just from a health perspective, it's very cost effective. So the federal government has to look at the cost effectiveness every year of all of the federal regulations. So we're talking about things like the Clean Air Act and federal legislation. Every year that this is done, the air quality regulations are the most costly, but they're also the ones which provide the greatest benefits. And depending on the specific regulation, for every dollar you spend, you get between $4 and $30 back in healthcare savings. So it's hugely cost effective. And again, the reason for that is if you make a change to improve air quality, everybody benefits. So that's just hopefully to sort of put things in perspective. So what I'm going to talk to you today is basically building off some of what Norm Anderson talked about. How can we think about actually designing our communities for health? And it's sort of, that's actually kind of a strange thing to even say. That's sort of what we should be doing. But actually we've sort of, I'm not sure why, but we've kind of designed our communities actually for cars to move around more quickly and more easily, which is kind of a strange concept because although that's good, I'm not a car hater. They provide great benefits, but we really shouldn't be designing our cities just for cars. We should be designing them for people, and health is a pretty important part of living. So behind me you can see sort of two images of the city where I live in. You can choose which image you prefer, but these are both sort of images that are common in many urban areas. So talking a little bit about asthma, and I'm going to start with asthma but expand to sort of other areas of health. You saw a lot of evidence already that air pollution clearly exacerbates pre-existing asthma. So it's definitely a trigger. We've known this for a long, long time. Here's just one study where mild asthmatics were taken on 2-hour walks in the center of London, where it's essentially 100% diesel vehicles. And then they were taken on 2-hour walks through Hyde Park, and you can see very clear differences in their lung function, measures of pulmonary inflammation, et cetera, just from a 2-hour walk in a clean area versus a dirty area. We have many, many studies like this. Perhaps more important is that trying to understand, actually, does air pollution cause asthma? And you heard previously, so Dr. Gentile talked about sort of how complex asthma is, and we know, like many diseases, many of these chronic diseases, there are multiple factors that contribute to asthma. And while it sort of sounds obvious that, air pollution should cause asthma, I would say the evidence until rather recently has been rather weak in terms of it being a cause for asthma. Why is that so important? Well, you saw actually how difficult it is to, even though we know how to treat and control asthma, sort of implementing that in the community is very difficult. There's lots of challenges, and it's very costly. So wouldn't it be great if we could stop asthma altogether? Wouldn't it be great if we could actually make inroads into decreasing the number of people who develop asthma? And that's really the goal. So what about the role of air pollution? Well, so here's this one study that actually looked at the level of air pollution, so the average level of air pollution across cities. So if you compare one city to another that has different levels of air pollution, does that relate to different levels of prevalence of asthma in those communities? And the answer is actually no. There's really no association in this analysis, so this is actually combining multiple studies between the community levels of outdoor air pollution and the prevalence of asthma. And this was sort of expanded to a global study. This is a study called ISAC, which is an international study of allergy and asthma in children. At its time that it was initiated, it was the largest epidemiologic study in the world, over 1 million children involved in this. And we did an analysis and basically showing, again, no association between the level of ambient air pollution and asthma prevalence measured at the community level. And then you also heard already today that sort of asthma prevalence has been going up as air pollution levels have been going down. Another sort of very interesting story, which sort of tells you the complexity of this, and you're probably wondering to yourself, why is this guy at this asthma saying air pollution has nothing to do with asthma? I'll get there. So East and West Germany, right, they were separated countries, and I actually started doing some work in East Germany right at the time of unification. And you went across the border, and it was like going back 40 years in time. So really heavily polluting industries. The cars were like 2-stroke engines, so kind of like driving old lawnmowers, heavily polluting. Some colleagues of mine did repeated surveys in these communities, and as these sort of traditional air pollutants decreased, so all of their factories were so inefficient that after Germany was unified, they just couldn't produce efficiently, so they all closed down. People started to get newer vehicles. So air pollution levels dropped dramatically, and asthma, allergic rhinitis, eczema, allergic diseases increased. So again, air pollution is decreasing, all of these diseases are increasing. And that shows you the sort of complexity of asthma and allergic diseases. And we think really, and asthma really is a disease of highly developed countries. So some of our most polluted places in the world today, for example, India and China, asthma prevalence is actually quite low. And we see as those countries develop, their asthma prevalence increases. But so what is it about development? Well, so there's all kinds of sort of lifestyle factors which we can get into, and those are things that we're working on. But there's also changes in the character of air pollution. And one of the things that was noticed in Germany is that even though some of these traditional air pollutants, like sulfur dioxide from a lot of coal burning, decreased dramatically, they did see a shift from these, let's say, 2-stroke vehicles to modern diesel vehicles, and they did see an increase, for example, in the very, very small particles, the ultrafine particles related to traffic. So some suggestion that, while depending on how you characterize air quality, well, it wasn't the things were necessarily just getting cleaner, but also the character was changing. And going back then to this international study, that ISAC study, some investigators looked at just a very simple question that they asked all the participants. So again, this is a study of over 1 million people. How often do trucks pass through the street where you live on weekdays? And that was actually associated with asthma prevalence. So even though the sort of community level air pollution was not, if you ask people really about traffic near where they live, that was a predictor of asthma. And that sort of led to this whole body of research, which is focusing on what we call near roadway pollution, living within, I think metric, it's hard for me to think feet, but 500 feet, no, I think that's wrong. 500 feet or so. That's the California, 500 feet or so from a major road. And that people are in this zone where they're being affected by the pollution from the traffic on the road. And that pollution then drops off quite dramatically if you go farther out from the road. So most of historically, we'd sort of focused on this sort of regional background air pollution. We know that if you go into an urban area, the air quality worsens, but we kind of ignored those little hot spots, those peaks. And these are peaks that are in most places related to major roadways, so freeways, major intersections, for example. But they also could be point sources, as you heard today. And we've developed approaches to sort of map these at very fine spatial resolution on the order, again, of 30 feet, for example, resolution. So we can actually compare somebody halfway down a city block from somebody else. So again, you can see, depending on the pollutant, that you get these very sharp gradients over space. When you did studies that way and looked at new onset of asthma, lo and behold, that you then saw this strong association. So this sort of traffic-related air pollution, proximity to roadways now seems to be associated with increasing incidence, so new development of asthma, especially in children. And again, this is just results from sort of combining multiple studies, including actually tens of thousands of people. We did a study to sort of hone in on this further, where we actually combined 5 or 6 studies, and we had information on genetic makeup of children. And some very common genetic differences that actually affect about 45% of the population. We found that most of this effect is actually in people with a specific genetic makeup. And when you look at those people, the risks are sort of even greater. People with sort of the normal, but the normal is only 60%. Genetic makeup really weren't affected that much. So that's kind of interesting, from a sort of biological mechanism understanding, but more importantly, that really, in my mind, erases all doubt about sort of other factors being important. I mean, people don't choose to live near a major road because of their genetic makeup, right? So they're randomly distributed based on their genetics, and we basically find that the effect is only in this subgroup of people. So I think what I'm telling you is that this is no longer an association. This is a causal relationship. So this traffic-related air pollution really causes children to develop asthma. And we also have similar studies for adult onset asthma as well. Again, showing that traffic-related air pollution causes asthma. So you can now, think about maybe even incorporating this into sort of, personalized medicine. We don't like to, in my group, we call it personalized health, where we should actually be thinking about how do we should understand people's genetic makeup and their susceptibility, but also understand their environmental exposures as well. And maybe there's some utility in thinking about that. We've kind of done some mapping, and the examples I'm going to show you are for Canada, but similar analyses have been done in the U.S. What we find is, in general, in the population, about 30% of the population lives in what we would call these sort of near roadway environments, high exposure areas. And a little bit more, 35% of primary schools in cities are located, again, in these high exposure areas. And again, the numbers for the US are very, very similar. So it's a substantial proportion of the population that is at risk just on the basis of sort of where they're living or where they're spending time. When there was an analysis done in Southern California, sort of now thinking about not just how air pollution is a trigger for asthma, but thinking about how this kind of air pollution causes asthma. And they estimated that there's about an $18 million annual cost of asthma in Southern California just from traffic-related air pollution. And about half of that was this sort of causing new cases of asthma. And the other half was sort of the treatment of people who already have asthma and how it's worsened by day-to-day changes in air pollution. So I'm going to sort of expand out. So that's a little bit on asthma. We've done a number of studies in the Vancouver area where I live, looking at sort of traffic-related air pollution and its impacts on children's and adult health. We have an advantage in Canada. We have universal health coverage. That's great in itself, but it also gives us access to wonderful data. So every contact that an individual has with the healthcare system, in order for that healthcare provider to get paid, they basically have to submit a diagnostic code that goes into a centralized system, and we can now use that data for research. So the results I'm going to show you are actually not a study population. So you saw how difficult it was from Dr. Gentile's work to sort of do these studies, recruit participants. We can just get the data and do these analyses on the whole population. So we followed 4 years of basically births of new children. We could study the moms during the pregnancy, how they interacted with the healthcare system, and then how the children interacted as they grew up. And we've now sort of followed this up to age 10. So we see that about 13% of new childhood asthma is attributable to traffic-related air pollution. So there's the number that we can get. I'll point out Vancouver is probably the cleanest city of its size in the world. That's partly because we don't have a lot of industry. It's also partly because we're located in the middle of nowhere up in the Pacific Northwest, so we don't have a lot of regional sources. But even there, it's this local air pollution from our primarily motor vehicles that's responsible. So about, again, 13% of new childhood asthma. We've seen increased low birth weight babies and babies that are born prematurely in relation to traffic-related air pollution. Bronchiolitis, which is a respiratory infection. So air pollution is not causing that infection, but it makes it more difficult to clear infections, so they worsen. And we're estimating about 6% of bronchiolitis is attributable to traffic-related air pollution. I'll point out that's, at least in our setting, that's the main reason that children in the first year of life are hospitalized. So again, quite costly. And middle ear infections, those of you who have spent time around children or have children, sort of how devastating an ear infection is. It's very painful. It causes parents often to miss work, and children who repeatedly get ear infections have developmental delays as a result of impacts on hearing. And about 10% of cases are attributable to traffic. We've also done studies just like this for wood smoke, and I can tell you much higher proportion of these sort of infectious diseases are related to wood smoke. Looking at adults, this is sort of one of the most fascinating studies I've been involved with. We looked at adults and again followed them over 10 years and looked at deaths from coronary heart disease. So coronary heart disease, sort of the main killer in society. And what we're showing you here is a comparison of people who never lived close to a major road or a highway, and compared to people who, throughout that 10-year period, always lived close to a major road. But more interesting, we also had ability to track where people were living, and there was a group of people that over that period moved closer to traffic, and their risk went up almost as high as the people who had always lived close to traffic. The good news is that people who started living close to traffic and moved away, their risk didn't drop down to baseline, but dropped down very, very low. So it's like quitting smoking. They quit their pollution by moving away, and basically they decrease their risk of dying from cardiovascular disease in a pretty dramatic way. Now, of course, not everyone can just pick up and move, and you may not even want to pick up and move. But what if we did something like move the road away from them or change the character of the road? And I'll show you some examples of how this has been done in other cities. So this is Munich, Germany. This is a major road that led out from the center of the city to their sort of ring road, their major highway system. And you can see in these images, it's very close to residential areas, basically just cut right through the city. What they did is tunneled it, cleaned the exhaust emissions in the tunnel, and have this wonderful linear park, which is now a place where people can, exercise, which is good for them. Property values increased, and it had no impact on the traffic because the traffic's actually flowing more quickly because it's sort of the tunnel system. The Big Dig in Boston is sort of a very similar example of this. So this is sort of a good news story, and you can't even say that this wasn't worth it because many people made a lot of money off this because all the developers, and you actually had use of land for housing and for recreation that was actually just taken up by the roadway. And there are many other examples of this around the world. Here's just an example sort of closer to home. This is a study of the introduction of the Easy Pass system in the New Jersey Turnpike. And so before they had the Easy Pass system, everybody had to stop, pay, and then go. So what you had at the toll plazas was a lot of congestion, and when vehicles are starting and stopping, there are more emissions. So this is a comparison of low birth weight and premature births. It's quite interesting. It's people who are still highly exposed. So it's comparing people who lived around the toll plaza with people who still live close to the road. So nobody's sort of unexposed here. And then looking at pre and post introduction of Easy Pass, and they saw about a 10% decrease in premature births in moms sort of living within 2 kilometers of the toll plaza, and similar reduction in low birth weight. So you get this for free, right? I mean, there's like no cost here. In fact, I'm sure the turnpike system saved money with this, but you get this huge health benefit without spending any money. So kind of remarkable, right? It's a miracle. When we start thinking about urban form and urban design and sort of the impacts of air pollution, we also need to think about other, so here's the weird thing that's going on again, other factors. And one of the things that really doesn't get any respect but is related also to traffic, and I think that's quite obvious, is noise. And noise we are increasingly becoming aware of as an important risk factor for heart disease, and actually other health impacts such as diabetes, and it's because noise causes stress. And many of these things are related to stress and subsequent inflammation. So we started looking at, well, what about air pollution, noise? I mean, shouldn't we, if we're thinking about air pollution and how it sort of varies across city, well, how does noise vary across the city? So we can kind of do the same things and make these very detailed noise maps, and then again, look at how that may affect disease patterns across the city in combination with air pollution. And it's quite interesting. What I'm showing you here is that same sort of study that I showed you about coronary heart disease mortality, but now we're looking at air pollution and noise together. And what we see, make a sort of long and complicated story shorter, is that noise and air pollution seem to have sort of independent effects in that they're both affecting heart disease mortality. Why might this be? Well, you think about, they have a common source, but actually the hotspots for noise aren't necessarily the hotspots for air pollution. Think about when a car is stopped at an intersection. It's actually rather quiet. That's when it's actually emitting the most, when it's idling. Cars that are, the road surfaces are actually an important determinant of how noisy a car is. It's not necessarily the engine, it's actually the tires. How they go over the road surface. So a bad road surface may be very noisy. That may have no impact on air pollution. So what we're seeing is that the hotspots are different, and they both seem to have independent effects in that they contribute to heart disease mortality. We also looked at the same kind of thing with birth weight, and it's a little bit more complicated. We still see sort of independent effects, but actually the noise effects were much greater than the air pollution effects, and we're still trying to tease out why that might be occurring. It may have something to do with sleep disturbances. So you don't sleep as well if you're pregnant, and especially in you don't sleep that well anyways during the last trimester. But that's actually when the baby puts on a lot of weight. So if that's sort of a time when moms are being stressed, more tired, that may affect birth weight. From the planner's perspective, and I think it's true also in Pittsburgh, there's been a lot of emphasis on sort of creating more walkable communities. And so if I talk to planners about health, they just say, oh yeah, I get it, density, that's good, right? We need to create these walkable communities. People don't have to drive, they get more exercise, wonderful, it's all wonderful. And we know there is that relationship that the sort of most sort of urban, most dense cities across the country, people walk more, and they use transit more, and actually people who use transit walk more than people who drive private vehicles, so because you have to walk to the bus stop or walk to the metro station. And we can map that as well. So my colleague Larry Frank is a leader in this, and there are several factors that we use to sort of determine which neighborhoods are the most walkable. So this is an image of a walkable neighborhood in Vancouver. And what do you see? Well, you see that cyclist very close to a car. You see buses, but it's dense, so there's a lot of opportunity for people to actually be exposed to air pollution. So we just sort of did a simple exercise where we took our air pollution sort of hotspots and our walkable and low walkable neighborhoods and kind of put them on top of each other. And what we came up with is sort of sweet spots and sour spots. So sweet spots that are sort of low air pollution and highly walkable, so people are able to get more physical activity in an environment that's clean. And those are the green. There isn't a lot of green up there, right? The red is sort of bad on all counts. It's bad in terms of air quality and walkability. And those are the sort of traditional kind of strip mall suburb communities that they're not walkable at all. They're sort of designed around motor vehicle, but they have sort of commercial areas where you also have sort of high both traffic related pollution, but also ozone, this sort of more regional pollutant. In most areas, things canceled each other out. And so if you had sort of a benefit from being in a walkable community, you had a disbenefit from that being a high air pollution, or vice versa. And this is sort of what a low walkable community looks like. So that was kind of interesting. And then we said, well, what does that mean for health? And we did an analysis, and this is sort of limited in terms of where we had the data that we needed to do this. So this is Los Angeles. That's not, LA is not the rest of the world, so keep that in mind. But we had survey data on over 35,000 people from a travel survey, so we knew exactly where they spent time. where they live, where they worked, how they got from home to work, other places that they visited. We had one of these detailed air pollution maps, as well as sort of a detailed walkability map. And then we sort of just looked at what we know about the risks of air pollution and the risks of low physical activity and how that related to neighborhood design. What we found was that, I'll kind of walk you through this here. So this is deaths per 100,000 people attributable to, so people living in a low walkable community. My mouse is going away. I think I have a pointer. Let me see, actually. Well, never mind. That's the middle. So that's a low walkable community. The darker gray, so that's the deaths. And then if you move to the high walkable community, which is on the right side, you have a decrease in the deaths from physical activity. So, so because people in highly walkable communities are walking more, you predict lower rates of deaths. But the middle part of that column is PM 2.5, so the particulate matter, and that also differed by those communities. So again, because the walkable communities are more dense, people are in closer proximity to vehicles and the pollution that they create. So those deaths that you saved, you got them back because of the air pollution. And again, things basically canceled each other out, which I would say was a huge surprise to me. I thought the physical activity benefits of being in the walkable neighborhoods would be much greater than the air pollution impacts. So why is that? Well, it goes back to that earlier point that I made in that if you live in one of these communities, you don't get to choose which air you breathe. If you live in these communities, you do have to choose whether you're going to walk or not, whether you're going to actually take advantage of that community being more walkable. And what we find is that only about 20% of the population, now again, that's LA. We know how sort of car-centric LA is, but only about 20% of the population took advantage of that. So most people didn't really change their behavior at all, or certainly didn't change it enough, even though they were in a walkable neighborhood. So it sort of shows you, you know, there's potential, but thinking about community design in a way that sort of involves individual choices, it gets more complicated. Again, that issue that air pollution, you get that benefit without even trying. And I would say that's a surprise for me. So other things that vary over urban areas are how green they are. And this is sort of an exploding area of research right now. There's been a small field, what's called environmental psychology, that for many years have done very small studies, very short-term studies, kind of taking people on a walk through a forest, taking them through a walk, down a city street. And they found very consistent differences in attention, measures of stress, so things like cortisol, blood pressure. If you take a walk in a forest, you relax, you calm down, you're less anxious. They even do therapy on this of people that have anger issues. So this is actually a clinical field in Japan, and you see all these benefits on the sort of short term, and that's been sort of very well known. So if you're ever feeling stressed and take a walk in the woods, it's a great thing to do. And there's certainly very sort of deep evolutionary reasons for that. And so E.O. Wilson, very famous biologist, for many years has been talking about biophilia. So this is this innate emotional affiliation that we have to other living organisms, including plants and trees. That's, we're part of that ecosystem. That's our natural environment. When we're away from that natural environment, we have not adapted to that. And, that sort of makes sense. And here's just sort of one, old study, but a really fascinating example. So these are patients recovering from surgery in a hospital, and they actually did a randomized experiment, and half of the patients were able to see vegetation out their window. Half of the patients, their view was of a brick wall in this hospital. And those that had a tree view had shorter hospitalizations. They required fewer pain-reducing drugs. Again, a small study, but you can very clearly, randomized trial, very clearly see these benefits. More recently, we've been starting to sort of study large populations and seeing if those sort of small studies actually translate over the long term to large populations. So here's a huge study, 41 million adults in the UK, and over 350,000 deaths. And what you see is the people who lived in the greener neighborhoods were basically less likely to die during that follow-up period. And it was most pronounced in people in lower income groups, but seen across all income groups. And mostly this was deaths from heart disease and stroke. And so the researchers sort of hypothesized that, again, this was something that, in their case, they thought this may be related to physical activity, but also a component of stress. So the idea being that if you're closer to a greener area, that's more conducive to physical activity. So a green area may be a park, it may be a place where you can go on a walk, for example. This is a study that I love. So this is from the Midwest. There's been infestation of emerald ash borer disease, which is a disease that kills the emerald ash tree. So this has been sort of radiating over space at different rates over time. And every time I think about this, it blows my mind. When the trees died, people died, both in terms of patterns of space and over time. So in the counties that had this emerald ash borer, there were about 7 additional respiratory deaths per year, 17 additional cardiovascular deaths per year. And it's really hard to think about, why this may be occurring, except for some benefit that actually people are getting from sort of being around trees. So here's sort of another study from the UK looking at people who moved, so kind of like the study I showed you for air pollution, people moving to greener areas or away from greener areas. And that you saw that people that moved to a greener area, they had sort of improvements in measures of mental health. People who moved to a less green area, they had sort of deficits in mental health that lasted for about 2 years, and then they actually sort of got back to baseline. But consistent improvements in mental health in those that moved to a greener area. So, what's going on here? So you can think about multiple pathways. So greener areas could be areas that have lower air pollution or lower noise. Not so much because trees remove air pollution or noise. That's a bit of a misconception. It sounds like a good story, but when people have studied that, it doesn't look like that effect is really there. There is a psychological effect. So if you actually plant a row of trees or a tall hedge alongside of a road, it doesn't reduce the noise or the air pollution, but you think it does. And that may be real. But in terms of reducing air pollution itself, it doesn't look like that's a strong sort of mechanism. But we know that areas that have a lot of greenery, there's just not a lot of sources of air pollution or noise. So if you look at one of those detailed maps, for example, of New York City, you can see Central Park is low air pollution, low noise. So it's this island of greenness. You can't drive vehicles through there. It doesn't have industry or anything like that. As I already mentioned, greener areas are places where we enjoy physical activity. So if that's a park or a recreational forest or even a golf course, we're getting some physical activity. And then there are those psychological benefits that I mentioned to you already that, again, maybe it's just seeing trees that calms us down. And then we also know that greener areas are places where we congregate with our friends and our colleagues. So we get benefits from being with other people. We know that's actually a strong predictor of improved health when we have social contacts. And green areas in our neighborhoods are areas that are conducive to that. So the park is where you can meet your neighbors and your friends. Sorry, I'm just going to pour some water here. So we tried to sort of do a study to kind of try and disentangle, how all these things might be working together. Again, using those administrative databases that we have available in Canada. So we linked a bunch of databases together. We know about moms and their kids and their contacts with the healthcare system. We're able to actually understand where people are living and if they're moving or not. Then we link those to these environmental data, these maps, and we study things like birth weight and prematurity, infant respiratory disease, as I mentioned, and then a number of adult diseases, so chronic obstructive pulmonary disease, heart attacks, strokes, diabetes, on and on and on. And we actually put all this together, and then we're trying to sort of tease out which of those pathways. So I'll show you a couple examples here. So this is looking at birth weight and prematurity as well, but let's just focus on the birth weight. This is showing the effect of living in a greener area. Basically, you get higher birth weight babies if you live in a greener area. If you then sort of adjust for individual factors, so socioeconomic, this would be maternal age and smoking and things like that. If you adjust for sort of the socioeconomic status, that lowers the effect. And then if you start throwing in things like air pollution, noise, how walkable the community is, that really doesn't have any impact on that effect. So what that means is that benefit of living in a greener area is independent of air pollution, how walkable that community is. And what we think is going on is that it's either that psychological or that psychosocial benefit that people are having contacts with others. And this benefit was seen across all income levels and both at high and low levels of education. So it's sort of one of these magic things that affects people regardless of sort of their individual status. We did see some differences by ethnic group. I don't think that's biological, that's just that different ethnic groups are in areas that have different levels of green space. It seems like from that study in relation to these birth outcomes that it's either the psychosocial influences or the psychological influences. We've also done the same kind of study with diabetes. So, and again, we see that people who are living in greener areas have about a 15% decreased likelihood of developing diabetes. If we then adjust for noise, that decreases the effect. So we know that actually noise is related to diabetes. So again, one of the interesting things about noise and sort of a stress related response. If we add in sort of air pollution, that has no effect. Walkable communities has no effect. So this effect of green neighborhoods seems to persist even after adjusting for these other environmental exposures. So in that case, suggesting that there is some role of pollution. Again, not really suggesting physical activity differences across neighborhoods make a difference, but that these psychosocial or psychological impacts may be important. And then here's sort of our analysis for asthma. This is just showing that in our study we have air pollution being related to increased development of asthma, and we especially see it in children who are born at low birth weight. So if you're actually born at low birth weight and are exposed to traffic-related air pollution, those are the kids that we're seeing have the impact of air pollution on asthma. But here's the good news, is that if you live in a greener area, you're less likely to develop asthma. And if we actually adjust for air pollution, the effect of greenness, so we're basically controlling for the level of air pollution in these analyses, the benefit of living in a greener area is enhanced. And this, again, was a surprise to us. You could think about sort of, well, trees, pollen, asthma, that may not be good. There's not that much evidence about sort of pollen exposure causing you to develop asthma. Obviously, if you have allergic asthma, being exposed to the pollen is a strong trigger. But it seems in our study, at least, that living in a greener area is sort of protective of developing asthma in the first case. So that's, again, quite interesting and provocative. And it's something that we're starting to look at in more detail, again, what is going on in a smaller study. So this is not the whole population. This is not 60, 80,000 people, born every year. But in a study of 3,500 infants and their parents that we're following in detail. So a very deep study where we're collecting everything from them. So we collect samples of, so blood samples, we're getting stool samples, doing detailed home assessments, and then measuring their outdoor environmental exposures. So one analysis we've done, again, very early look at these kids. They're only about 5 years old now, but at age 1, we saw that traffic-related air pollution led to an increase in mostly food allergy in these children. Whether that's sort of going to be a persistent effect, we'll need to see. One of my colleagues has looked at the level of their, the types of gut bacteria that they have. So this whole area of the microbiome being an important determinant of disease. And they found that the children who are both allergic and early wheezers, so which seem to be the children that actually develop into severe asthmatics. At 3 months of age, they were deficient in 4 common bacteria. And while the children who did not develop early allergy or wheeze actually had these bacteria. And so there's a whole bunch of factors that relate to the gut microbiome. So we know actually that children who are born by C-section, that alters their microbiome, and they're more likely to develop allergic diseases. Children who are treated early in life, very early in life, with antibiotics, and C-sections actually go along with antibiotic use. But we're also going to look at things like green space. So again, you can think about a greener environment in your neighborhood, more potential for children to contact a more diverse array of microbial life. So whether that's when they're crawling around and digging in the dirt, or just sort of, again, passively by being around soil, being around trees, rather than being sort of in a more sterile concrete environment. So this is something that we're going to probe in more detail, and I don't have any results for you now, but quite intriguing, to say the least. So moving on, and how am I doing for time?
You're actually doing very well. You have 5 more minutes.
Okay, perfect. So just to talk a little bit about building off of some of the things that Norm said about how do we deal with sort of these exposures and especially to air pollution. Most of our policies to date have been what I would call sort of uniform exposure reduction policies. So if we have an air pollution problem, we'll put policies, let's say, to change the tailpipe emissions, and that's good. I mean, that's or we'll reduce the emissions from a power plant or an industrial source. And those are the policies that have really been put in place and have given us those decreases in air pollution that we've seen. But if we have to now think about things that are more spatially targeted, so how are we actually going to deal with those hotspots? Obviously, still doing these things like improving tailpipe emissions is a good thing, but I can tell you it's been 30 years when I've consistently hearing from auto company representatives that, the air coming out of the tailpipe is cleaner than the air coming in over 30 years, yet we still seem to have, pollution from motor vehicles. And it's true that, emissions are much, much lower than they were. There's been dramatic improvements, but part of that gets offset by increasing numbers of vehicles. And part of that gets offset by a small percentage of vehicles are really bad actors. And so in theory, and when new and when well maintained, vehicles are very clean. But if they're not maintained, and that goes for older vehicles or newer vehicles, so all our newer vehicles are highly computer controlled. If there's a faulty chip, everything can go out of whack. And we know that a very, very small percentage of the vehicles contribute most of the pollution. So there's an issue there, but also just thinking about we still have these hot spots. So that's just sort of numbers of vehicles. Cars, even though they're very clean, they're not, they still have some impact. So we might have to think about sort of spatially targeted measures. And I think, Norm gave you some examples. He talked about siting of new buildings for vulnerable populations. That's something that we've been promoting. We can thinking about truck routes and limiting truck traffic to certain routes, which we already do for safety purposes. But maybe we should think about doing that in terms of sort of exposure as well, or certain times of the day. So, might not be that crazy to think about not letting trucks drive, when schools start getting out or when kids are going to school, when a lot of people are outside, for example, or locating truck routes or commuting routes in general, or sort of locating busy roads away from areas where we want people to be walking or cycling, for example. So there are a number of strategies we could think about. You can also think about tools for the individual. So this is something that we developed kind of as a proof of concept a number of years ago, and it was so popular that we had to keep it running until we completely ran out of time and money to do it. But this is a route planner for cyclists, and one of the things that we were studying was sort of barriers to get people to try cycling as a form of commuting. So cycling has sort of benefits to the individual. It's a way that they can get sort of regular physical activity without having to go to the gym or spend any money, and they still, get to work or get to school. But many people saw lots of barriers, and safety is a huge barrier. But any of you who have tried cycling as a form of commuting, you probably know that it takes you a while to sort of find a good route. And I've known that when I moved in other cities, it takes me like 3 weeks to find the optimal route, and those 3 weeks are really scary. Because you're driving down a road and all of a sudden, oh, I don't think I should be here, right? Like there's cars coming at me from all sides. So we designed a route planner that would sort of take advantage of cycling infrastructure, what are the safe routes, but also routes that were clean, away from air pollution, or greener routes, or routes that were with the fewest hills. And this was, hugely popular. So you could put in, here's where I am, here's where I want to go, and it would route you to do that. So these are the kinds of tools that we have today. And of course, we all, nowadays we kind of live our lives on our smartphones and with our mapping apps and things. So we can use this sort of spatial technology to really help us. And here's another example that I like. This is a study, sort of another proof of concept study done in London, where they had people going from point A to B and just let them go by different routes, but then had them rate whether that route was beautiful or quiet or happy. And they took images of that route, and then basically were able to model beautiful, happy, and quiet streets across the whole city of London, and sort of showed that if you took a preferential route from one of these factors compared to the shortest route, you only increase your distance by like 12%, which is, isn't that much. So you don't waste a lot of time. And so again, if you knew about it, maybe you would sort of go on a happier route. I don't know what that means, but it makes you a happier person. And could reduce your stress level, again, could have impacts on health without really much cost, certainly no cost, to society. I sort of mentioned walkable communities. Are people familiar with Walk Score? Who's put your hands up if you've heard of that? So a number of you have heard of this. So this is actually a group of software developers who used to work for Microsoft, and they got sort of tired of working for the corporation and want to do something good for the world. They developed this website where you can map any address in terms of how walkable that neighborhood is, and so this has become quite popular. It's a tool that realtors are using to attract people to certain areas. It's sort of become one of these things, in addition to price and crime, et cetera, that people that use to determine where to live. There have been a few studies showing that higher walkable communities are associated with higher property values and actually higher industrial or office property values as well. We work with them to develop Bike Score, so same kind of thing, but how bikeable is a location, and that's a little bit different than walkable because you have to deal with things like hills, whether there's bike infrastructure, a bike lane, for example, as well. So you can have these tools, and so they've developed approaches to say, like, if I work in this building, here's the walk shed. So here's an area within 20 minutes where I could get a 20-minute walk, I could get to my workplace. And then it'll pop up all the apartments for rent, for example, in that walk shed, or you could do it in a bike shed. So biking, allows you to expand the area that you can get to within 20 minutes. So here's, again, some tools that people could use. Just a few things to sort of wrap up, that we're seeing some interesting trends. In the US, vehicle miles traveled has stagnated and probably decreased. And there's some pretty detailed analysis that shows this isn't really due to economic changes. So this is really a sort of structural and demographic change that we finally stopped. Every year this was going up, and we finally sort of stopped that. So as a society, we're actually driving less. In Europe, there's been really dramatic decreases over time. And in the US, there's a 6% increase in the past 5 years in the number of households without a car. And I find this actually surprising, but 10% of the households in the country don't have a car. But here's the stat that I find fascinating. So this is looking at the percentage of licensed drivers by different age groups. And I know that when I was on my 16th birthday, I took my driving test and got my license. And throughout my teenage years, the car was the center of my social life. And that is absolutely not true for teenagers today. So what's the center of their social life? Their phone, right? Yeah. And actually, if you're the driver of a car, so when I was a teenager, the person who had the car was the one who made the decisions on what you're going to do. That was the person with power. Now the person driving the car, actually, it's a liability because you can't be looking at your phone, or you're not supposed to be looking at your phone. So we've seen a 20% decrease. So if you look at 18-year-olds, for example, comparing 1983 to 2014, there's a 20% decrease in the number of 18-year-olds with a driver's license. So again, teenagers don't want to be driving. So as communities, first of all, we should be responsive to that. And that's good news because we spend a lot of money on our road system. And if that's actually not what the younger generation wants, we can actually use that money for other things. And then, of course, there's the negative impacts as well. We've also seen new models of vehicle ownership. So I've actually haven't owned a car for a while. I did get a car to teach my kids how to drive. I had to beg them to learn how to drive, actually. And they got their licenses not on their 16th birthday. It was like their 18th or 19th birthdays after I was begging them. Just this is a skill you should have. And then we got rid of the car after they learned how to drive, and we share a vehicle, and I tell you, it's wonderful. Just not being tied to a vehicle that you own. And if I want to drive a truck one day, or if I want to drive a minivan, or if I want to drive a sports car, I get to choose. So many cities are seeing car sharing And then we have bike sharing as well, and I noticed you've got that actually in Pittsburgh, which is great. So there's other choices that people can have. Also, the next wave is self-driving cars, driverless cars. So yeah, it's going to be good for our dogs. You don't need to take them to the park; they can drive themselves to the park. But implications for us, and I'm not sure what this means for health. This could be a really good thing. It could be a really bad thing. So the model is kind of like, it's like Uber without a driver, right? There's all these cars just sort of driving around. If you, you click on your phone, here I am, and I want to go here, and all of a sudden a car appears. That could be good because could be sort of more efficient, but it may make it so easy that we drive everywhere. So I'm not sure what that means, but that is clearly coming. And if you talk to the experts on this is something within the next 10 years we're going to start seeing this. So the technology is there. So we'll keep our eyes on that, but I think the dogs will be happy. So just to wrap up, so I think asthma, and as was said earlier, most of these chronic diseases, they're multifactorial. They have multiple risk factors, but some of these factors are related to urban form, and we need to be thinking about this. We should be thinking about designing our cities for health. In the US, 82% of the population is urbanized, so most of the population lives in urban areas. Wow, wouldn't it be a smart thing to sort of design our urban areas to be healthy? I think everybody would like that, right? We see consistent associations between traffic-related air pollution and development of new childhood asthma and adult asthma. The evidence is growing as well. We know that for things like asthma, but also many other diseases, that early life exposures are important. So and I mean really early, like pregnancy or the first 3 to 6 months of life. So that's a group that we really should be aware of. The risks are relatively small in terms of air pollution. So air pollution is not the main killer. I don't want anybody to sort of go away thinking that. But because we're all exposed to it on a population basis, it becomes quite important. So I mentioned the stats, and again, very similar in the US, that about 30% of the population lives, works, goes to school in those high sort of traffic pollution areas. And again, just suggests the sort of cost effectiveness of that primary prevention. If you can do something that benefits everyone in the population, stop that disease from occurring in the first place, that's a real win and becomes really cost effective. So we see these sort of health disparities across urban areas. We have some examples of interventions leading to benefits, and there's also co-benefits. So if we can design places that are clean, green, quiet, walkable, you get air pollution reductions, maybe you get these psychological or psychosocial benefits from a greener area. People are more likely to engage in active transportation or physical activity, getting all these benefits. So I will stop there. Thank you.